Thank you so much for joining us for a night of inspiration. We can't wait to start the evening. We have some really great things we want to show you, but we aren't ready yet. First, we need to make sure you have our signature snacks and mocktails ready. This year, we're going to be honoring Ilise Zimmerman, our president and CEO, who's retiring after 28 years of dedicated work supporting women and children. And if you know Elise, you know that popcorn is one of her favorite things. I've got some Parmesan garlic popcorn here. We just took some grated Parmesan cheese and mixed it with garlic powder, Italian seasoning, and some crushed red pepper. The red pepper is optional, but I like a little spice with my snacks. You're going to pour that along with some melted butter or oil over your popcorn and then toss everything together. After that popcorn, I bet you're going to be thirsty, so we wanted to get a tasty drink going. Elise is definitely a dessert person, so I'm going with a dessert drink here. I've got about a quarter cup or 2 ounces of chocolate milk, an ounce of either milk or half and half, and an ounce of coffee. And I added those along with some ice, crushed ice, to a shaker. And we're going to give it a quick shake. And then strain into a glass. Delicious. If this isn't to your liking, we've got some other recipes up on the website for different signature snacks and mocktails. And we hope you will snack and drink along with us. And thank you again for supporting the partnership and its work.
I'm Lorelli Frias. I'm a supervisor for the Healthy Families and Parents as Teachers programs. I provide support and guidance to our home visitor so they can teach new parents how to form healthy bonds and provide a safe environment for their children. I am the partnership.
I'm Sunny Lewis. I'm a volunteer on the Gala committee. I give my time because I'm passionate about the health and well-being of women and their children. Times are so difficult, and helping is something that I am committed to do. I am the partnership.
My name is Erica Correa, and I am a program specialist at the Morris County Family Success Center. I support families by empowering them to successfully meet life's challenges. I am the partnership.
I am Boanne Foster, the founder of Life After 2 Losses. I am a volunteer and an advocate. I've experienced 2 preventable second trimester pregnancy losses, and I give my time to help women who've experienced loss. I am the partnership.
I am Ruth Malero. I am a nurse with the Nurse Family Partnership Program in Bergen and Passaic counties. I empower pregnant women and new mothers to help families thrive by improving pregnancy outcomes, promoting child growth and development, and encouraging economic self-sufficiency. I am the partnership.
I'm Linda Tintawi. I'm a board member and the chair of the Gala committee. You are the partnership. Our hospital partners, donors, community collaborators, volunteers, and staff members. You make our work possible, and we are so grateful. I'm thrilled to welcome you to a night of inspiration. Like just about everything in 2020, our gala will look a lot different this year. COVID has changed our lives dramatically. Throughout the show, you'll hear from voices in the communities and learn how the partnership has adapted to meet the needs of the women, children, and families we serve. While it may not be our typical gala, it is an opportunity for us to connect and have some fun. We'll also honor Ilise Zimmerman, our president and CEO, who, after 28 years of tireless advocacy, commitment to excellence, and remarkable achievements, is retiring. Our fast-paced program is packed with mission moments, stories from the community, and testimonials to Elise and her outstanding accomplishments. And it just wouldn't be the Partnerships Gala without dancing. We hope you will feel inspired to get up and move during our dance breaks. Throughout the evening, we'll share highlights from our silent auction. Please bid. The auction will close on November 19th. Your generosity will help support the partnership's 40 programs that support women and infants, empower communities, and engage healthcare professionals to ensure that all people, regardless of race or ethnicity, will have access to equitable healthcare. When Elise began her career with the partnership 28 years ago as the consortium director, the first office was in Patterson at St. Joseph's Health. It is fitting that we begin the evening with a performance by the Patterson Music Project. Enjoy the show.
Hi, my name is Rachel, and I have been playing viola with the Patterson Music Project for 6 years. Thank you so much for inviting the PMP Sextet to perform for your gala this year. Even though we are unable to be together in person, we feel fortunate to be able to make music together virtually. Today, we will be performing 2 pieces for you. The first piece is Barcarolle from the opera Tales of Hoffmann by Offenbach. The second piece is Mother is a Precious Jewel by Godwin Sato, a Nigerian folk song reminding children to love and respect their mothers, who brought them into this world. We hope you enjoy our performance.
Hello, everyone. This is First Lady Tammy Murphy. Thank you so much for the opportunity to be a part of this special event for the Partnership for Maternal and Child Health of Northern New Jersey. Although I wish we could be together in person, I am thrilled to see the gala go on despite the challenges of COVID-19. It is my very special privilege to join with all of you in honoring Ilise Zimmerman, founder, president, and CEO of this remarkable organization. All of us at Nurture New Jersey are incredibly grateful to Elise for her guidance and leadership in advancing the cause of maternal and infant health. For 28 years, long before Nurture New Jersey was created, Elise has been a strong and passionate advocate for the mothers and babies of New Jersey. She has used her considerable talents, business expertise, and public health knowledge to grow the partnership into an organization that is widely respected and now known throughout New Jersey and across the nation. And she has been a trusted partner to Nurture New Jersey. Elise has attended every Black maternal and infant health leadership summit, many of our family festivals, and helped to make our most recent one in Jersey City the most successful festival to date. The legacy that Elise leaves behind at the partnership is more than just a successful career. It is evidence of the incredible person she is, compassionate, inspired, and dedicated to helping others. For all you have done on behalf of the mothers and babies of New Jersey, and all you have done to inspire those around you, we thank you. God bless and best wishes for the next exciting chapter.
Good evening. Thank you for joining us in a night of inspiration, a virtual fundraising gala for the Partnership for Maternal and Child Health. My name is Mike Lamacchia. I'm chair of the Board of Trustees of the Partnership, and I'm also chairman of pediatrics at St. Joseph's Children's Hospital. This year, the COVID-19 pandemic has created an unprecedented public health crisis. Our region has suffered tremendously with the loss of loved ones, the constant fear of resurgence, and financial insecurity for families across our nation. The pandemic has also disproportionately affected communities of color and those already feeling the effects of the social determinants of health. The partnership has transitioned well during this tumultuous time and continues to serve families in need. The partnership also continues to provide education, and it now does these activities in the virtual space and in record numbers. The good work of the partnership continues to be made possible by the support of the member hospitals. Sometimes it is when the skies are darkest that the brightest rays of light pour through. I have witnessed the generosity of time, talent, and treasure at every level. First responders, nurses, physicians, and other clinicians, and essential workers of all types, working tirelessly and placing themselves in harm's way. My good friend, Dr. Jim Pruden, Director of Emergency Preparedness at St. Joseph's Hospital, was one of those individuals. He was on the front line, as he always is, and he was infected with COVID-19. Fortunately, Jim pulled through, despite it almost costing his life. He is an inspiration to all of us. We are grateful to all those heroes for their bravery, professionalism, and kindness. As we work together to adjust to a new normal, we are reminded that the path is not a straight one. I am hopeful we will all emerge stronger. Once again, thank you, member hospitals and supporters, and thank you, Ilise Zimmerman, who is this evening's honoree. She, as president and CEO of the partnership, has led the organization with great passion and extraordinary vision. She is a tireless advocate and a giant voice for women and children in our community. I am honored to work with her and consider her a great friend. Thank you.
Hi, I'm Barry Ostrowski, and I'm proud to be the president and CEO of RWJ Barnabas Health. Elise, there's a rumor going around that you're retiring. That can't be right. You're in the prime of your career. But in case it is true, I want to take this opportunity to thank you and congratulate you. Congratulations on an incredible career making our communities healthier. Your attention to those who are giving birth and those for whom equitable care has not always easily gotten is, quite frankly, historic. Thanks to you, the suffering that many would have endured has been reduced. Now, as to the thank you, I want to thank you for your friendship. You and I have worked together for decades, I'm afraid, and in every case, you have brought to me and to us the warmth and support that you are now famous for providing. You have helped us see our way clear to make a contribution to our communities. You're a wonderful professional, even a better friend, and I wish you the best of luck during this retirement. Be well, Elise.
Hello, Elise. On behalf of myself, Chuck Kasser, our CEO, Ira Robbins, and the entire Valley Bank team, we wish you the best of everything in your upcoming retirement. We commend you on your leadership and dedication over the past 28 years in bringing to the forefront the issues facing mothers and children at risk right here in our own backyards of Northern New Jersey. Through your work at the partnership, the health of many women, children, and families, and especially those of color, has improved through increased community awareness, education, and resources. And none of that would have happened without your passion and your persistence. Valley is so proud to have such a strong relationship with you, both personally and professionally, as we work together serving the populations that need us the most. Congratulations on an outstanding career at the partnership and one that you should be so very proud of, and the best of luck in your future endeavors. I can assure you, you will be missed. Thank you.
Hi, Elise. I just want to congratulate you on an incredible career and what you've built at the partnership. I didn't know about the partnership until you told me about it. We've been friends for a long time and neighbors, and I've just been blown away, especially as I've become a mother and realized that the hardest job I've ever had is being a mom. The work that you all do to try and make it easier on mothers who are struggling everywhere has impressed me constantly. And I know the partnership is going to go on and continue doing that work. I just want to thank you for the time, for the sacrifice, and the effort that you've put into building this great foundation. And thank you all for everything that's there. Looking forward to seeing you a little bit more now that you might have a little more time on your hands. But congratulations to you and congratulations to the partnership. And thank you so much for everything you all do.
Good evening, and thank you for joining us tonight. I'm Liliana Pinata, and I serve as the Chief Operating Officer for the partnership. First, I would like to take a moment to acknowledge our President and CEO, Ilise Zimmerman. and thank her for 28 incredible years of leadership and for building an organization that is well respected statewide and nationally. On behalf of all staff, thank you, Elise. I'm also very happy to have this opportunity to say a heartfelt thank you to our wonderful staff for their hard work and commitment to improving the health of women, children, and families. It has been a very difficult time for all of us due to this public health crisis, but I'm pleased to report that it's been a very successful year for the partnership. I'm very proud of all our program teams, and I wish I had the time to share with you all their success stories. I'm going to highlight just a few of our accomplishments for this year. All our programs have successfully transitioned to virtual work from the beginning. We are providing professional education via webinars and panel discussions. Overall, there has been a 5-fold increase in attendance compared to last year. Our programs exceeded their goals in providing education to the community through virtual support groups, home visits, and case management via telehealth, virtual health fairs, and family activities. Our priority is always ensuring the safety and health of high-risk women and their families. We're able to distribute COVID-19 safety and educational kits, laptops for children funded by a community foundation, and free phones provided by our collaborators. Also, our teams develop new grant proposals and secure additional funding to implement 2 very important programs: Power to Protect New Jersey, a statewide flu campaign, and FELA's Fatherhood Program, a federal funded 5-year initiative. Now I would like to share with you a video, an example of a fun parent-child activity. Thank you and enjoy.
Hola a todos, mi nombre es María Soledad, espero que se encuentren muy bien en sus casas. En este día me gustaría compartir con ustedes una actividad súper fácil y divertida para hacer con sus niños. Estaremos creando pintura para el piso, básicamente es como tiza. En inglés se llama chalk paint. Comencemos. Ok, para esta actividad solo vamos a necesitar 3 ingredientes: la maicena, el agua y colorante de comida. En un recipiente o en un vaso vamos a añadir 2 cucharadas de maicena, vamos a añadir 4 cucharadas de agua, y como vamos a hacer diferentes colores, por eso puse diferentes recipientes para añadir el color. Y mezclamos. Espero que les haya gustado y no se olviden de seguirnos en Facebook como el Morris County Family Success Center. Gracias.
Good evening. My name is Harold Pearl, and I'm a neonatologist at the Joseph M. Sanzari Children's Hospital at Hackensack University Medical Center. I have known Elise for over 20 years, but as a founding chairman of the Board of Trustees at the partnership, I had the privilege of working alongside her and seeing her in action up close. It has been an honor and my pleasure to work with her. Elise, there's no doubt in my mind that the growth and success of the partnership has been as a direct result of your leadership and your unwavering commitment to improve the health of women and children in northern New Jersey. On behalf of the maternal and child health team at Hackensack, and on behalf of hundreds of mothers and children, I would like to thank you for all that you have done. Congratulations and have a great evening.
I remember the first time I heard Elise speak some 15 years ago. Seriously, she lit up the room with her passion for the cause. She inspired me instantly, and I've been involved for the past 15 years. So what is it about Elise that makes her such an extraordinary leader? Well, it's not just her brilliant mind or her compassionate heart, or her endless commitment to the health and welfare of mothers and children and their families. We have to add her tenacity, her curiosity, her creativity, and her endless energy of 100. But the magic that you sprinkle on top is that she makes fun out of everything that you do. She really inspires those around her. She allows people to feel that they're heard, they feel her presence, and they feel appreciated. It has been an honor and privilege to serve with you the past 15 years, Elise, but the greatest honor has been the friendship that's been cultivated along this time. I wish you all the best in whatever your next steps are, but I am certain, whatever it is, you're going to be making the world a better place for those around you.
Elise, only for you would I get up early in the morning, do my hair, put on makeup, just to congratulate you on your retirement. I really don't know how MCH is going to get along without you in New Jersey. You have done incredible, great things. I am incredibly proud of you. Be well during this retirement. See you soon. Take care now.
I want to wish you many lazy mornings over a hot cup of coffee, and time to garden, and time to spend in the country, and hopefully time to go to the theater again. And then when you get bored, I'm sure opportunities will open up for you to do new and exciting things.
Elise, I just came by to wish you a much well-deserved happy retirement, and just to tell you that one of the highlights of my public sector career was working with you. As I saw you navigate the politics of governmental officials and state bureaucracies and community organizations to deliver top quality services, and to the mothers who may not have gotten prenatal care had it not been for your heroic efforts, I want to salute you.
Hi, Elise. Over the past 28 years, we watched you grow this organization from its inception as the Consortium for Maternal Child Health to the partnership that it is today. The women and children of Northern New Jersey have benefited from all the programs and everything you've done for them. We love you, we admire you, and we wish you the best of luck in everything your future has to offer.
Elise, it's been a great pleasure serving on the board under your leadership over all these years. Best of luck.
L'chaim.
I met Elise over 25 years ago when I was first hired. My first impression of Elise was that she was personable, enthusiastic, and driven. She had a clear vision for this organization and was definitely a trailblazer along the way. Over the years, Elise rose to every challenge with courage and an unwavering determination, which is why the partnership is so successful today. I'm so grateful to have had an opportunity to work with Elise and be a part of this amazing organization. Elise was a wonderful mentor and was always willing to teach others along the way. Elise, thank you for your inspiration, laughter, integrity, strength, and empathy. On behalf of the entire staff, we thank you for being such an extraordinary leader. You will be profoundly missed. Congratulations on this well-deserved honor.
Mom, for the majority of my life, I have watched you build and grow the organization now known as the Partnership. So much of what I have learned about being a professional has been from observing you and your leadership. Over the past 27 years, you have nurtured a community around the Partnership. I'm always so impressed and so grateful to listen to stories of the women, the children, and the families of the lives that have been touched and supported by the Partnership. So much of the world of public health is often faced with frustrations or disappointments and challenges. And I've seen you face those head on and remain resilient and committed to the work that you're doing. Yet again, we find ourselves in the world of a public health challenge, and I'm so impressed and so grateful to the staff of the Partnership, to the employees, and to the entire community to transform a gala, which we all know and loved and wish we could be all together, into an online celebration. So I love you, I appreciate you, and I'm so glad that we're all here together to celebrate you.
A Night of Inspiration is an apt theme to honor both the Partnership and you, Mom. By committing to improve the lives of women, children, and families, the Partnership inspires mothers to take the best possible care of themselves and their children. But the Partnership, its staff and outreach workers need inspiration too in order to provide resources and services. And most of that inspiration comes from you. I am incredibly proud to have watched you dedicate yourself to your career filled with passion over the entirety of my lifetime. You have worked tirelessly to ensure that every grant and every outreach program is designed to achieve the utmost success. And I couldn't be more excited to share with people that I had a working mother who was working for mothers. I love you so much, and I'm so proud of you. Mom, you are my inspiration.
I have the pleasure and delight of being married to Elise for almost 42 years. From the moment I met her, I knew she was different. Remarkably intelligent, enormously curious, and passionate about making a difference. Back in the 1970s, she chose 2 simultaneous master's degree programs at Columbia, one in the School of Public Health and one in the School of Architecture and Planning. Not because one program wouldn't keep her busy, but because she knew the dual degrees would give her a broad understanding of both public health and public policy. She had the drive, but wanted the academic knowledge for what has become a distinguished career in research, community service, and commitment to improving the lives of those less fortunate. A toast, therefore, 28 years after creating the Northern Consortium and the Partnership for Maternal-Child Health, Elise can retire knowing that her turn in charge has been filled with success. And although the mission continues, no one could have done more for the underserved and underprivileged women in New Jersey. Congratulations and love from your devoted family.
Good evening, everyone. My name is John Goldsmith, and it is my great honor to present this well-deserved award to Elise this evening. For those of you who don't know me, I joined Elise's board in 2005 and have worked with her as a committee chair, a board chair, an executive committee member, and a dear and cherished colleague. What can I say about Elise that has not already been said in her many tributes tonight? 28 years of service to Maternal-Child Health Consortia as the Chief Executive Officer, a statewide leader in public health, a dedicated career working to reduce racial disparities in maternal-child health care for almost 3 decades, and so much more. I will only say this. I have never worked with someone who is so dedicated to her cause, so passionate about her clientele, so doggedly determined to achieve success, and so caring for and collegial with all of her work colleagues. She never, ever stops thinking about the challenges ahead and how she can meet them head on in leading the partnership to a better, more secure place for all. She is an inspirational leader for everyone at the partnership, all those the partnership serves, and all public health officials who come in contact with her. She can never, ever be replaced. On behalf of the Board of Trustees of the Partnership, it is my great honor to present this leadership award to my dear, dear friend, Ilise Zimmerman. Where are you? Oh, here you are over here. Here you go.
Thank you so much, John. This is really wonderful, and I really appreciate the fact that you wore your special tie tonight. This evening marks an important milestone. 28 years ago, my older daughter, Stephanie, was about to begin kindergarten, and my younger baby, Michelle, was about to begin in preschool. My husband was working as an architect, and I was about to take on a part-time consulting gig to create something called a consortium for maternal and child health. I really had not a lot of insight into what the state of New Jersey had in store because I was a New Yorker. But I came across the bridge and I read these regulations and I was impressed that the state of New Jersey thought that competing hospitals could work together for the sole purpose of improving the health of women and children. In other words, the regulations stated that we were supposed to decrease the number of infants, children, and moms who died for preventable causes. This was a pretty intense goal. In fact, in business terms, it was one of those big, hairy, audacious goals. So I took on this challenge and I interpreted the regulations by writing bylaws, by developing a standard operating manual, by developing a personnel manual. And I suppose that the work that I did was considered good enough because the Board of Trustees at the time hired me to become the first executive director of the consortium. Now, in terms of the recruitment of both board members and staff members, one of my proudest accomplishments is that there must be almost 20 employees who have been here with me for 2 decades. And there are at least 15 out of our 40 board members who have been with me, struggled with me, and succeeded with me in these challenges. Now, thanks to the insights of the community, our organization has made the community a priority. They're the ones who are the most knowledgeable about their healthcare needs. We have done focus groups. We have done neighborhood canvassing. We have interviewed individuals and have come to learn that when you're trying to provide health care, it's critical to ask patients what they need and how they would be willing to receive it. Our very first grant was from the Robert Wood Johnson Foundation, where we offered to teach women who were in recovery to become doulas and support pregnant women during their prenatal phase and during labor. It was a challenging grant, but it gave employment skills to women who otherwise did not have them. Another grant, which was somewhat innovative, was the creation of the Black Infant Mortality Reduction Center. Our organization was cognizant of the difference in the lifespan of Black infants versus white infants. We were aware of this difference very early on. In fact, the United States Surgeon General David Satcher came at our request to address a statewide audience on the disparities in healthcare, and this was in the late 1990s. As a result, the Department of Health funded the consortium with funds to create a Black Infant Mortality Reduction Center to focus on strategies to decrease racism, because we acknowledged that those behaviors, those harmful behaviors, resulted in poor health outcomes. So how did we grow from a $100,000 small organization to a $10 million organization with 5 different sites and 130 employees? I think I was lucky. I was really lucky because of my background in public health and urban planning to be offered the opportunity to work in this space. I want to thank my family, and I know it sounds corny, but if you use the word conference call, both of my daughters will go, here she goes again. I need to recognize my husband because he has never expected me to make dinner or to do the laundry. He knows that this job is more than just part of my career. It's a passion. And I have to also thank those who have worked alongside of me, in front of me, beside me, behind me, for believing that I had good judgment and allowed me to be a leader. This fall, my daughter Stephanie became engaged to be married. And my younger daughter Michelle is living with her boyfriend and their newly adopted rescue dog. My family has not only been supportive, they have also championed the values of this organization. I think that the greatest opportunity occurred for me when I was given this position to work amongst colleagues and work with friends and have the support of my family to achieve an incredible mission: the improved health care of the women, the children, the men, and the families who are living in New Jersey. I want to thank you from the bottom of my heart, sincerely.
Congratulations, Elise. You truly are an inspiration to me, to the community, to the board. Thank you for all you've done. I hope you enjoyed the evening. Thanks to the generosity of our supporters like you, we continue to impact the lives of nearly 40,000 people across northern New Jersey each year. We will conclude the gala by sharing our electronic journal. Please take a moment to view our sponsors and read the beautiful, heartfelt messages our donors created for Elise. And a quick reminder, the auction closes on November 19th. Please keep those bids coming in. Thank you again. Good night.